Good morning, everyone, to a time when there is a lot going on in our society, including for employers dealing with the California surge as well as the nationwide surge of COVID. We'll try today to bring you up to date as recently as last evening so that you have an idea of what issues are going on and how to make decisions for your own organization. There a surge nationwide. You may see for the last 14 days, the new COVID cases nationwide has been approximately 138,000 per day. California is having its own surge, and in Southern California, both Orange County and Los Angeles are experiencing this issue. Although the numbers seem small compared to what they were in January of this year, the concern is that the rate of increase is dramatic. And the last few days data indicate that at best we have plateaued. We have not, in our area at least, started declining on the number of instances. But the concern is shared by government agencies, which have been very active, as I'm sure you've seen, employers of all types, institutions like schools and other facilities. So this is attempt to try and just bring you up to date on what's going on. For most of us in California, we opened up in California on June 15th and changed our rules starting June 17th with new revisions to CalOSHA rules. And then a month later, we started to shut down and have actions by government agencies because of the surge. So some of you are more than aware, on July 17th, Los Angeles County and other jurisdictions required wearing face masks in all indoor work areas. On July 27th, the CDC recommended that everyone wear face masks indoors in areas of substantial outbreak, and California and statewide is in substantial outbreak. Also on July 27th, the California Department of Public Health and the governor ordered vaccinations for all state employees and healthcare related workers. And this healthcare related workers is a broad definition. And in some of the cases, the option was either get a vaccine or not work. Some the orders are vaccine or subject yourself to weekly COVID testing. On July 29th, the Department of Public Health recommended wearing face masks in all indoor areas. On July 29th, the federal employees and federal contract workers were ordered to be vaccinated or submit to regular tests. On August 11th, California ordered mandatory vaccination or regular testing for workers in schools. So this has been progressing very rapidly. The federal government just announced yesterday a new recommendation that fully vaccinated persons receive a booster shot. And this would be 8 months after receiving their completed first round. And I thought the initial announcement applied to Johnson & Johnson vaccine, but it doesn't because they don't have enough data yet. So the 8-month rule applies to people who got the Moderna or the Pfizer vaccine. Although I'm sure by the 20th of September, which is the date these new shots will be available, that the Johnson & Johnson vaccine will be included. It's not included quite yet. Various local jurisdictions have been very active, including the San Francisco Department of Public Health, which has issued a revised order mandating businesses to require patrons age 12 or over, as well as employees, to provide proof of vaccination. Hosts of establishments where food or drink is served must follow this rule, and also gyms and recreational facilities. Now, this happens to be San Francisco, but this is not limited to the city of San Francisco. And also these orders, as this came out on the 12th of August, are changing regularly. So you have to keep in touch with your local, either county or city Department of Public Health for your rules. Now, just to recap briefly, the CalOSHA standard, which is still in effect and has not been modified, took effect June 17th. And it basically said in this purpose that employers can require face coverings for all workers indoors, or if you wish to relax the rule, you could allow documented, fully vaccinated employees to work without face coverings indoors. Employees who are not fully vaccinated, who decline to provide proof or a self-attestation of vaccinations, should continue to wear face masks. So this is a little more liberal rule than some of the most recent announcements. And it's entirely possible that CalOSHA will modify its own rule if the surge that we're experiencing continues. Los Angeles County revised its public health order on July 17th that all persons, regardless of vaccination status, must wear face coverings in all indoor public settings. Now, there's an exception for while you're consuming food and drink. It also added rules for large venues such as arenas, stadiums, and music events. And some of you are familiar now that the latest announcements affect facilities that have 1,000 or more attendees. As a result of this, and also because of the problem we're experiencing because of so many of our population still unvaccinated, there are a lot of employers that are adopting mandatory vaccination rules. And we'll talk a little bit about what the mandatory rules could be. But I think you're generally aware of the University of California system and Cal State University, which are enormous employers in our state, as well as California school employees, many hospital systems, Disney, Tyson Foods, Delta, and a lot of others. This hasn't been updated for every day when new companies announce it. There are also across the country some 700 colleges that are requiring people to be vaccinated to be on campus, which includes students as well as faculty and administrative staff. In the San Francisco Bay Area, the requirement to wear masks indoors, and this is indoors, was effective August 2nd. Alameda, Contra Costa, Marin, San Francisco, San Mateo, Santa Clara, Sonoma, and the city of Berkeley adopted these. And this type of ordinance is expanding statewide fairly rapidly. So things to think about for your company. First of all, what is your vaccination policy? You may or may not have had one up to now, but now is a great time to think about it because we have an interesting question now. When we talk about fully vaccinated, last week we would have said fully vaccinated was a person who either had both shots from Moderna or Pfizer or the single Johnson & Johnson shot and had 14 days since the shot. Does the term fully vaccinated change in September when the booster shot becomes available? The government will not make you make that change, but the question for companies is, what is our policy? What are we going to do? And what are we going to do about booster shots? I'm also concerned about whether you know who as employees have been vaccinated. I think it's very important, if you haven't already taken that step, that you do that, because the vaccination status is becoming a critical issue of compliance and of these various orders. So it's important that you know who is vaccinated. And now it appears that you need to know when they were vaccinated so you can understand what may be facing us in September and later. Most people in California did not get vaccinations until February, which means that 8 months from February will be the first time. Between February and March, there was widespread immunization in the state. So this means really in October and November, this issue will become critical, although some people did get vaccinations in January. Now, the question also is, how are you, if you're going to go this way, how do you obtain proof of vaccination? And in the past, many people allowed self-attestation, and it's a specific option allowed under the CalOSHA rules. But be aware, as you probably know, self-verification isn't acceptable for some types of work areas. Healthcare workers, school employees, state employees, federal employees are not able to simply self-verify. You don't have to change your policy, and you can continue to allow self-verification, but you may want to think about how do you obtain and record the status of your employees as being vaccinated. Realizing that the information you obtain about vaccination status is health information, which needs to be restricted to people in your company who need to know. So this can't be something broadly publicized to everybody, but that does not stop you in the health privacy laws. The HIPAA laws do not prevent you from asking this question for those of your business who need to know, which probably includes supervisors, people in charge of assigning employees to work areas, human resources, and so on. Second thing you need to think about and maybe rethink about is, what is your mask policy? Are you going to have a requirement that everybody wear it even if you're fully vaccinated? Or are you going to only require it for non-fully vaccinated employees, which is essentially the rule for everybody in California, at least, to wear face masks if you're not vaccinated? Having the policy is one thing, but how do you monitor it? And how do you monitor COVID cases and exposures? And therefore be able to give notice to people who've been exposed, make decisions on who can come to work and who needs to stay off, as well as some other processes that we'll talk about, which include offering testing and offering time off for vaccinations. And if people don't want to vaccinate, or if they claim they have a physical disability to prevent them from wearing a mask, there is no accepted religious objection to wearing a mask. However, there are some people who have physical limitations that make wearing a mask difficult. How is your company going to handle anybody who's exempt or excused from your rule, whatever the rule is? And I can strongly suggest to you, and we can help, that you have people make this request for exemption in writing. Don't take word of mouth, because there's an old saying in CalOSHA, if it isn't written down, it didn't happen. But people are very contentious about this issue, have a lot of different opinions, emotionally and otherwise. And employers just want to play it straight and know what the facts are and be able to show that you were objective and that you made your decisions based on facts that were presented to you. This is just a reminder of the general rule. Every employer in California needs to have a written COVID prevention plan now. And basically it's a written plan. It deals with face coverings. It deals with testing. It deals with who must stay off work. It deals with pay if people have COVID and can't work, or how you preserve their job. How do people notify you? And what kind of contact tracing are you going to do? The regulation itself doesn't require any formal process of contact tracing, but you need to think about practically, what are you going to do? I had an employer just yesterday who called, who had an employee who had informed him in the morning that he had COVID. Everybody in the plant, including this employee, were wearing masks, and all the other employees in the facility are fully vaccinated. So what do you need to do to inform those type of folks? And in that particular instance, even though everyone else was wearing masks and was fully vaccinated, people needed to be reminded of what the symptoms of COVID were and to report to the company if they develop those symptoms. This is so-called difference between asymptomatic and symptomatic disease. So some definitions under the CalOSHA rules, and I'm using the CalOSHA rules because they're more complete than most of the public health orders, and they apply to everybody as a minimum set of standards. An employee is considered fully vaccinated now if the employee is documented that he has received at least 14 days prior either the second dose of the 2-dose or a single dose vaccine. Is this going to change come September 20th? Possibly. Close contact. An individual is within 6 feet of a COVID case for a cumulative 15 minutes within a 24-hour period. And this is regardless of whether they're wearing a face mask or not. This definition, I'm sure, is pretty standard and not likely to change. What's the high-risk exposure period? For COVID-19 cases who develop COVID symptoms, the high-risk period is 2 days before they develop symptoms. And that is because there's a lag time between when you get the disease, and also when you're transmissible, and knowing that you have the disease by symptoms developing. So a high-risk period is 2 days before they develop the symptom. And let's face it, you don't know that until you're going back after a reported case to say who may have been in contact with this person. And until 10 days have lapsed, or after the symptoms disappeared, and there have been 24 hours with no fever. For persons who test positive but never develop COVID-19 symptoms, the high-risk period is still the 2 days before they developed it until 10 days after their first positive COVID test. A COVID case is somebody who's tested positive for COVID. So if somebody feels ill and says, I have bronchitis, that's not a COVID case unless it's tested positive to confirm their status. Face coverings. We've evolved from a lot of pretty homemade type remedies in February and March of 2020. Most people today are using specifically prepared face masks, either private ones or ones they've made or ones they purchased. It's basically a surgical mask or a respirator, and it needs to have tightly woven fabric. So some of the face coverings that were initially sold only had one layer of fabric and were easy to use. I liked them myself because it was comfortable, but it didn't have the protection that we need because of multiple layers. So scarves, ski masks, bandanas, single layer fabric doesn't qualify as a face cover. Proof of vaccination. So there are ways that you can get proof of vaccination. One is to get an image of the vaccination card. And the value of that for employers now is it not only has proof the person had the vaccination, but it also has the dates. So if it becomes important to track time for booster shots, you'd have that information. At this time, it's still lawful to allow people to self-attest their vaccination status, and an employer simply maintain a record, which again is a medical privacy issue of who self-attested, except that in a lot of settings now, the public health agencies or other government orders are not accepting a self-attesting test as a proof of test. Employers who don't want to ask about or document their vaccination status must be treated as unvaccinated. And here I can also say, and some of you know, on the internet now, for anywhere from $25 to $125, you can buy fake vaccination cards. It's interesting to me that people would go that far when you could get a free vaccine. However, there is possibility somebody may in your workforce try that process. We're not identity experts. This isn't any more of a restriction than the normal I-9 immigration status investigation you do of newly hires. But you do want to, any document that's presented to you, at least does it appear on the face to be valid and appropriate. You should have some way of screening for COVID-19. And part of this is being aware of the symptoms. And the symptoms have evolved. And different people have different systems. So some people have fever, some people have chills or cough, some people have shortness of breath, muscle aches, sore throat, loss of taste, but it's not necessary that people have one of these or more than one because it's a personal reaction to the disease. Respirators are important, or face masks. The CalOSHA rule requires a respiratory protection device approved by the National Institute of Occupational Health and Safety, or NIOSH, such as an N95 filtering face piece respirator. It is not clear that surgical masks or multi-layer masks are inappropriate. But under California law, most employers need to have N95 masks available to employees who request them or need them. So this is something to be aware of. I don't know that I would change and require N95 masks. There's some cost to that, although they're increasingly less costly than they used to be. But you do need to provide some device or mask to your employees at no cost. Most employees don't need that, but you need to have it available. For unvaccinated employees or people in an exposed group during an outbreak will need to wear masks, even vaccinated people. The other question is, how do you tell your employees that there's been an exposure? And many of you know this. This is not brand new. The regulation changes haven't dealt with this. But basically, if you have a COVID case, meaning someone who's tested positive or diagnosed by a health officer, that's a COVID case. And you need to tell people in the work site, not the whole building necessarily, but the work area. The original rules talked about the whole building, but now we're talking about the work site area, that there's been someone, and not saying who, has reported a COVID infection. The period for infectious period is 2 days before the system to 10 days after. So within one business day of a COVID case that you know or should have known, employers need to notify employees in writing. Now, in writing can be by email, it can be a poster, or it can be a notice given to employees that employees at the work site during the exposure period need to be aware there was a report. This also applies to other people who work at your site, such as independent contractors. In the event that triggers notification is that you know a person's been diagnosed. You need to tell people that you have free testing available on paid time to those who've had close contact. And again, close contact is people who have been within 6 feet for more than 15 minutes. And give them some information about COVID relating to your benefits. And the employee may be entitled to certain benefits, workers' comp, state disability benefits, and so on. Testing is an issue which is optional. Who can be tested? Generally, the rules don't require employers to require testing, but they do require making testing available. And who must be made offers of testing are unvaccinated employees with symptoms, regardless of close contact, unvaccinated employees after close contact, vaccinated employees after close contact if they're symptomatic, unvaccinated employees during an outbreak being 3 or more COVID cases within a 14-day period, and a mass outbreak is 20 more employees within a 30-day period. You don't have to make testing available to fully vaccinated and recently recovered employees for 90 days. All employees, regardless of vaccination status during a mass outbreak, meaning 20 or more, must be offered testing. And the testing should be at no cost and on company paid time. You can send people to get tested. You're not required to make testing available during normal work hours. Those are options on if you offer testing and people need testing, how are you going to handle it? Employers must exclude from the workplace employees who had close contact with a COVID-19 exposure until the return to work requirements are met. But this does not apply to people who've been vaccinated who have not developed COVID symptoms. And just a reminder, there was a provision under the federal law that employees who are involuntarily terminated or laid off because of COVID could be eligible for subsidized COBRA premiums to continue their health coverage. This provision, which has not been affecting many of our clients, the policy provision ends September 30th of 2021. So return to work is an issue. Cases with COVID should not return to work until at least 24 hours have passed since fever was resolved, their COVID-19 systems have improved, and at least 10 days have passed since the symptoms first appeared. COVID-19 cases who tested positive but never developed symptoms still should not return to work for a minimum of 10 days since the date of their COVID test. If you need to keep up to date with what's going on, the easiest is the internet site called covid19.ca.gov. I've also put the Centers for Disease Control website, cdc.gov/coronavirus/2019, because they have a wealth of information for employers there. But the operative site is the covid19.cal.gov site, which gives you up to date all orders from the governor, the State Department of Public Health, Cal OSHA, and so on. Because we envision that people are going to need to be dealing with mask issues and have N95 masks available, as well as an ongoing need for testing. And I am sorry to say, I think this will occur certainly through the month of September to allow for whatever surge extender happens because of the Labor Day holidays, but could easily continue through as long as Thanksgiving, although none of us hope or expect that. But you may need to have some materials and supplies to help deal with this issue. We entered into a supply agreement, and this is just an option, where we would make available a wide array of very affordable masks and on-site testing, rapid antigen testing and other testing, as well as a lot of other services, at a 20% discount from their list price to any client of our firm. This is not because you need to do this, and you may have suppliers you already use, but I just wanted you to know we're trying to make this available as an affordable place. So as an example, they have the 3-ply surgical face masks available. They also have the N95 masks available. And interestingly, some of our manufacturing clients have been interested in foot or boot covering because of the areas that they operate. And this is also another supply, but they also have a wide array of testing materials. So you can do on-site testing to make your status much easier without a lot of time. Those are the things that I know of that have occurred in the month of August that affect you. We're here to help you, and please let us know any way we can. We have time for questions. And let me just say, I think if take away from this, figure out how to know if your employees have been vaccinated or not. Think about how to deal with this issue of the duration of the vaccine's effectiveness. And then think about what your policy is going to be for allowing people to work. There's no right answer to this. It's only an answer that works, makes sense for your business. Now, if you're dealing with outside employees, and I know some of the people on the call have outdoor employees, the rules are totally different. These mask requirements and so on don't apply to outdoor employees, only to work done inside. So with that, Jake, if there are any questions, I'd be glad to try and help.
Yeah, the first question is, we have a couple of employees who are quarantining because they were in contact with someone who tested positive. Do we need to advise staff of this, or only when an employee tests positive?
If the people were in quarantine but weren't at your work site, so there wasn't a workplace exposure, the 15 minutes and 6 feet, the mere fact that they're on quarantine because of whatever reason doesn't require notice to employees. What you're doing is you need to notify people who could get a workplace exposure.
We have an unvaccinated employee who sits in an office with the door open / ajar but no mask. Is that acceptable?
The exemption for wearing a mask for an unvaccinated person is a closed office, so that areas where people can walk by, can pop in, doesn't qualify as an exemption from wearing the mask. If they don't wear a mask, and I can understand that, get up and close the door.
Is it lawful to incentivize employees to get vaccinated by monetary funds?
Absolutely. There's no limitation on your ability to either use rules that require vaccination or steps that improve. I'm sure you've seen a variety of steps Let me just tell you that under the workers' comp claims, the claims that are COVID related that are covered because of the workplace exposure, the average cost of one of those workers' comp COVID cases now is $37,000 for treatment for their lost time and their medical care. So this is an expensive proposition to someone who gets COVID. So anything you can do to make your operations easier, smoother, avoid disruptions, and just by the way, protect the life and health of your employees and their families is certainly allowable. And as you know, things have been offered all the way from Krispy Kreme donuts to Budweiser and Samuel Adams beer. So you can even be creative in what you offer.
I've heard mixed information as to whether KN95 is okay instead of the N95.
The KN95 mask is acceptable. And the advantage of the difference of the two, KN95 is in the area of 80% effective as opposed to the N95 mask that's in the area of 98% effective. The N95 mask, you need to teach people how to fit the mask. The KN95, which is really usually a fabric or cloth or paper mask with earlobes, it doesn't require any particular fit testing. The masks always have to be worn correctly, which includes covering the nose and the mouth. But they're certainly acceptable. They're less affordable, but I would tell you with our new supply program, even N95 masks are surprisingly cheap.
Any recommendations as to how often testing for unvaccinated employees should occur?
I would think that there's several approaches. Some companies have required twice a week test. I think that's excessive. Most common is if you're not vaccinated, you have to test weekly. Some places like the Los Angeles Unified School District have resorted to random tests so that a person doesn't have to necessarily get a test every week, but they daily are doing random tests throughout their school system. So there's a little bit of flexibility in terms of how you'd impose and what frequency you'd ask. Most commonly would be weekly because it only takes a couple of days for the disease to develop. And we're in such a surge that this is not a time when, as early June, when we thought we had resolved most of these problems. Hopefully we'll return to that level in September.
When you say an employer must make testing available to employees, are you stating that an employer should have the PCR self-test available in the workplace?
When you make tests available, you can make tests available by telling people you can go to, for example, the CVS or Walgreens drugstore or a lot of other places that offer testing. Many pharmacies offer testing. The issue is who pays for the test, and some of those are free and some of those are not, and the time it takes to go and get them. So I think there's a value to having self-testing kits on the work site if you have any significant employees who are not vaccinated, because it just makes it easier for you to have to face the lost time issues. Early on when this was happening, there were employees who would claim they were getting a COVID test and be off work for a whole day. Well, there was nowhere that anybody needed to be gone from work for a whole day to get a CVS test. But once they're out the door and not at your work site, you don't have a lot of control. So the value of having on-site testing is that it makes it very prompt and quick and takes away those problems.
Can we require our employees get vaccinated?
Well, yes, you can. Depends on your vaccination policy. And the only limitations on that are if people have a medical issue that prevents them from being vaccinated or have a sincerely held religious belief. And in those cases, that doesn't mean they're free or able to return to work. It may mean that they're on unpaid leave of absence during this period. It may mean other accommodations like work from home. But we do suggest if anybody is not getting vaccinated, that you have a way for them to request an exemption So you can identify if in fact there is a medical condition or other issues. But you certainly, part of that's on how your workplace needs to develop its vaccination policy. But if you're a healthcare related employee or a school related employer, that's been taken out of their hands. They can't have people work on their premises, mostly in a date in September is the effective date of those rules.
Is it okay for unvaccinated employees to not wear masks when sitting at a cubicle by themselves as long as they put one on if someone comes to their cubicle area?
No,
They
because a cubicle is too loosey-goosey and you can't, that's why it's a closed door is the only exception to wearing a mask. And frankly, also, anybody who isn't wearing a mask is encouragement to other people to not comply with this rule. And it's much better from an employer standpoint because you're responsible for this. To simply say, this is the rule. Look, if 3-year-old kids can wear masks at daycare centers and 6-year-olds can wear them in kindergarten, you can wear a mask to work here.
We are a medical practice who uses laughing gas during procedures. The laughing gas has a handheld mouthpiece, and the patients have to lower their mask to use the laughing gas. Do you recommend to stop using it for the time being?
No, I think that all of the medical providers, including dental offices and other physician offices, obviously need to conduct the testing or the medical procedures or your regular services. And also realize there is a 15-minute period window. But clearly, if you're in a dental chair having a root canal, you're going to be more than 15 minutes without a mask. And the rules all recognize that medical or other operational issues are relevant and apply.
Should we require our unvaccinated employees to be tested? What if they resist?
They have a choice. They can try and get unemployment, but they shouldn't be qualified because it's a voluntary choice on their part. They have the ability to comply. Your risk is, and I would tell you, whether you're wearing this or not, Walmart in California was fined $2 million by CalOSHA for not following the rules. And this was early in 2020 after the new regulations from CalOSHA were adopted. But you're responsible for the health of your employees as well as risk for fines for noncompliance. Also, there's a tremendous increase of people filing complaints with CalOSHA about failure to follow COVID practices. And CalOSHA has devoted it as the primary enforcement activity other than heat illness and now wildfire smoke illness. So this is not a trivial matter. This is a serious matter.
What is the exact date employers can mandate vaccines at a healthcare facility?
You can adopt that rule anytime you want. We would suggest you sit down with someone and plan what your policy is going to be and give people time and realize there's a 3-week gap between the first and second vaccine. So many people who've adopted vaccination policies have adopted a 30-day advance notice of the policy to give people time to get in. But part of this also depends on knowing how many of your employees are already vaccinated. Because if it's only a few, you have a different issue than if you have half or 3/4 of your workforce to deal with.
Will the recording of this webinar be available or emailed to us?
The recording will be posted on YouTube and usually about a day or day and a half after today's program. And so we can't send you the recording. We can send you the PowerPoint slides, but the presentation itself will be available. And Jake's in charge of that, so he knows how that works better than I.
Yeah, so send an email to info@CalWorkSafetyHR info@CalWorkSafetyHR.com, and we'll get you a copy of the slides or the recording. So we have a couple more questions. Does someone trained have to administer or someone from HR be there as employees self-test if we have tests available on site?
They don't have to be a medical person. You need to follow the directions on the testing materials. And we've had our own team who engaged in these self-tests. We did early when they were first available from home. And I think is somebody competent who can also make sure that employees understand what the procedures are, although the directions are on the package.
And what are the best recommendations for recording on-site testing results?
My suggestion would be there's several. Just make a note in a file that is medically confidential, meaning not available to general persons, that indicate time and date, yes, no on testing. Because obviously if the test positive, then you need to deal with the issue of exclusion from the workforce. But you do want to know that a test occurred if that's what you require.
Is the PCR test the one that requires it to be sent in and wait for the results?
I'm not an expert. We have some that are knowledgeable medical personnel on the call than I, but send us that question and we'll have one of our medical staff respond to you on that.
Is the rapid test effective enough at this point to be trusted?
The rapid test is about 50% valid, but if you take it 24 hours apart, two tests, you increase the reliability of the test dramatically. And frankly, it's practical. Everything's a trade-off here. And I think what you're doing is doing the best you can. And hopefully you're dealing with people without symptoms, because that also helps protect you from the spread of the disease.
We are having a tough time finding staff. I'm concerned about implementing the vaccine requirement for fear of losing people that we have. I even had one employee tell me he would only get it if we required it as employers, looking for any and all alternate plans.
Well, hopefully the Food and Drug Administration by September 1st or 5th will give unconditional approval to the Pfizer vaccine. That's been pending since May. And they've indicated that they would be acting by early September. So there are a certain percentage of people who are reluctant because it's an emergency use authorization on the mistaken thought that this means it's experimental. None of these vaccines are experimental. They've gone through at least 3 different phases of testing, including the last phase, which was a mass test of 30,000 or more, and monitoring results for 6 months or more to determine results, and which is one of the reasons we're now getting this information about the booster shot, because they've been following some of these vaccinations who were in the trials, 30,000 each, for 10 or 11 or 12 months now. So they're developing some pretty good information. I don't know how you tell someone we love you and care about you and we want you to live and be healthy. And all you have to do is watch a 15-second clip on the news channels of someone who has COVID who says, I wished I'd gotten the vaccine. I don't know how else to explain it. Although listen to people, try to be responsive or put them in touch with places where they can get information. I don't think this is I think frankly, the way we're going to get out of this issue is mandatory vaccination by large employers, because we can't get there with the 50% vaccination rate that we have now in this country. Even in California, we have only about a 60% vaccination rate.
So if we have any more questions, go ahead and send them in the chat.
You might want to go to New Mexico. New Mexico has the highest vaccination participation rate, I think, in the country. So.
All right. Well, with that, thank you so much for sharing. This is an important topic. And remember, if we did not, oh wait, we got one more question. Due to HIPAA laws, can we have any staff member be there to administer and record on-site test results, or does it have to be an HR person due to confidentiality?
It does not have to be an HR person. HIPAA merely says that you protect and respect the privacy of the information but that you are able to do regular business. So you could have your receptionist do this. You could have an administrative assistant. You could have a supervisor. Does not have to be an HR person. It would be helpful if there was a little training for the person who's doing it so they understand the issues. But there's no requirement of a particular credential to be able to be the person who monitors this information.
All right. Thank you, everyone. And as a reminder, CalWorkSafety and HR is dedicated to helping businesses remain compliant and successful during the COVID-19 pandemic. Be on the lookout for future topics on our website, and be sure to send us an email at info@calworksafetyhr.com for a copy of the slides or the presentation. Thank you for joining us. Stay safe, healthy, and have a wonderful day.